हाँ मैंने लाइव कर दिया। Alright, hi guys, very good afternoon. Let us see the evening session of pharmacology that was asked in your recent examination of NEET PG 2024. One of the questions that we got from the student that they ask about a middle-aged patient suffering from headache and blurring of vision while watching movie. Upon examination, the pupil was mid-dilated. Mid-dilated vertically fixed pupil is actually suggestive of angle closure glaucoma. And in angle closure glaucoma, we try to decrease the intraocular pressure, right? So for decreasing the intraocular pressure, we will be using mannitol. So if you are going to see mannitol, mannitol is there in every option. They are asking mannitol and what else. See, atropine will not be given because atropine itself is a mydriatic agent. Glaucoma का rule ये होता है, if any drug is causing mydriasis will be avoided, and if it is causing meiosis, it can be utilized. So among the given choices, pilocarpine is one of them, which is M3 agonist that can cause meiosis. It can be utilized. So this will be the correct answer. I hope that this question, all of you have got this question correct. The next question that we are having is a loading dose of lidocaine. Lidocaine is one of the drug that can be utilized in arrhythmia. It's a local anesthetic drug. They are one of the class 1B, right? Mannitol plus carboxymethyl cellulose. Now, अगर ये एंगल क्लोशर ग्लोकोमा का हिस्ट्री के साथ जा रहा है तो मान लीजिए मैनिटोल प्लस कार्बोक्सीमेथाइल सेल्यूलोज is still the answer will be mannitol plus pilocarpine. ठीक है, very good Dr. Aman, right? Now next is going to be the loading dose. They are asking the loading dose of this lidocaine for the treatment of arrhythmia. Lidocaine is one of the class 1B antiarrhythmic drug, right? So it is dependent on which factor? Bioavailability, clearance, volume distribution. See, loading dose is usually dependent on the volume of distribution. If the volume distribution is high, we always try to give loading dose. Loading dose हमेशा volume of distribution द्वारा decide होता है, ठीक है? A person was an antihypertensive drug has symptoms like constipation, dry mouth, and dizziness. He missed to take this antihypertensive drug while he was on a trip, and now having high blood pressure. See, whenever we discussed a very famous drug that is known as your clonidine, so दो चीज़ें इसके बारे में बार बार बताता हूँ. एक तो इनके यूजेस के बारे में बोलता हूँ. आई यूज टू टेल यू फ्यू इंपॉर्टेंट थिंग इन क्लासेस. वन इज एग्जामिनर के कुछ ड्रग फेवरेट होते हैं, जैसे एट्रोपिन है, क्लोनिडीन है, रिजरपिन है, वीमैट2 इनहिबिटर. दे आर देयर फेवरेट, है ना. सो क्लोनिडीन के बारे में एक तो इनके यूजेस के बारे में, एंड सेकंड वन इज द साइड इफेक्ट. साइड इफेक्ट के लिए डू रिमेंबर दिस वन. डॉक्टर क्लोनिडीन इज अ वेरी सिंपल mnemonic that I used to tell you. Dr. Clonidine is a mnemonic that you need to remember. We are not going to discuss all the mnemonic. Just remember D. We used to discuss that D stand for your dryness of mouth, dry mouth. R for rebound hypertension. Now this rebound hypertension again is a very important side effect. Constipation. C stand for your constipation. C stand for your constipation. And LO stand for your low mood. LO stand for your low mood. Low mood बोले तो depression. So they increases the depression risk as well. So low mood. So आने वाले examination में पूछेगा which of the following antihypertensive drugs should be avoided in depression, right? We are not going into the whole detail. Just remember that for the constipation, hypertensive emergencies like scenario, right, or rebound hypertension like scenario will be caused by your drugs like your clonidine. Amlodipine will not have any such kind of side effect. Amlodipine is one of the calcium channel blockers. It's a DHPs. They will be associated with ankle edema. Constipation cause कर सकता है, लेकिन वो rebound hypertension less likely. Lisinopril is ACE inhibitor, angioedema, dry cough, वो सब है. Telmisartan likewise will have side effect similar to ACE inhibitor but will not have bradykinin mediated side effect like dry cough, angioedema. Telmisartan के साथ नहीं होगा, ठीक है. Which of the following growth hormone analog used in the treatment of HIV associated? At any point of time, you guys feel that this question was, let's say the option was a little different or question was not there, please feel free to message in the comment section. Okay? Because this is the first, hand question that we have got from the students. We'll have a detailed analysis later as well. Which of the following growth hormone analog is used in the treatment of HIV associated lipodystrophy? HIV associated lipodystrophy में we'll be using definitely growth hormone analog. नाम ही है growth hormone, so they are going to increase the muscle mass. Now tesamorelin is one of the agent. Tesamorelin, bromocriptine. First and foremost नंबर पहले rule out करते हैं. Bromocriptine है क्या? What is bromocriptine? It's one of the D2 analog. And dopamine, do you guys know? It is always having inhibitory effect on the growth hormone. तो ये तो growth hormone analog होगा ही नहीं. Likewise, octreotide, it is one of the somatostatin analog. It is one of the somatostatin analog. It is also not going to be a growth hormone analog. ये तो growth hormone के उल्टा काम करता है. Now we are left with the micasermin and tesamorelin. See, micasermin है क्या? Micasermin, it is one of the recombinant IGF-1. Recombinant insulin like growth factor 1 analog, and they will only be utilized if the growth hormone receptor is resistance. ठीक है, growth hormone receptor resistant है. If you want to treat dwarfism and situation like that, you can utilize. Tesamorelin is one of the agent, that is GHRH analog. GHRH analog is tesamorelin. Tesamorelin is something that we can actually utilize for this condition. AIDS related muscle wasting हो गया, या कोई भी muscle mass को अगर increase करना है, और if you want to increase the growth, we can utilize. ठीक है. अगर पेग्विसोमेंट ऑप्शन में है, पेग्विसोमेंट, और क्या ऑप्शन में था? नो ऑक्ट्रोटाइड. ठीक है, ऑक्ट्रोटाइड नहीं था तो पेग्विसोमेंट होगा. अगर ऑक्ट्रोटाइड नहीं था तो that hardly matters, because पेग्विसोमेंट is also one of the growth hormone receptor antagonist. पेग्विसोमेंट भी तो ग्रोथ हार्मोन का एंटागनिस्ट होता है ना डॉक्टर्स. ठीक है, वो भी होगा. चलिए, टेसामोरलिन ऑप्शन में था. लेट अस से दैट अदर्स वर नॉट इन ऑप्शन. जब बाकी ऑप्शन नहीं थे, क्या टेसामोरलिन ऑप्शन में था? तो पेग्विसोमेंट तो मैंने रूल आउट कर दिया डॉक्टर. ठीक है, अगर टेसामोरलिन ऑप्शन में था तो दिस इज गोइंग टू बी द करेक्ट आंसर. ठीक है. नेक्स्ट वन, अ पेशेंट वाज एन एंटी डिसलिपिडेमिक ड्रग developed flushing, hyperglycemia and raised liver enzyme. See, among anti-dyslipidemic drug, जब भी आप word सुनते हैं flushing episode, you always go with the niacin. Niacin is a very good drug. It's considered as one of the best drug that can increase the HDL level. The only limitation is their side effect. The side effect like maculopathy, the side effect that they're having is going to be amblyopia, right? Amblyopia, flushing, GI related side effect, right? So they are their important compliance limiting side effect, और इसलिए compliance limiting और side effect था, तो niacin will be the correct answer. This is one of the compliance limiting side effect. Remember that. So for the question like this, dyslipidemic drug causing flushing dyslipidemia and raised liver enzyme, again remember it's also hepatotoxic drug. Plus, not only that, they increase the glucose level as well. They are a hepatotoxic agent as well. They are also associated. These are the other side effects that are associated with this class of drug. ठीक है. Which of the following drug can cause QT prolongation when used with erythromycin? Now, QT prolongation, erythromycin, this is not a new question. Again, this has been asked in the previous examination as well. Remember, any enzyme inhibitor will be associated with QT prolongation. ठीक है. Now, erythromycin itself is having enzyme inhibiting property. Plus, erythromycin is one of the macrolide. They have shown to have QT prolongation property. Now, among the given drug, the one drug that is having QT prolongation property or enzyme inhibiting property is going to be your estemizole. इसीलिए whenever we discuss our drug from the antihistaminic drug, उसमें दो ड्रग के बारे में मैं बार बार बताता हूँ. One is estemizole and other one is terfenadine. Estemizole, terfenadine, these are the drug. estemizole, terfenadine, these are the drug. They are very very potent enzyme inhibitor, और इसीलिए इनको clinically use नहीं करते हैं. They are not utilized clinically. Do remember that. चलिए, प्रोमेथाजीन अगर ऑप्शन में था, चलिए मान लेते हैं प्रोमेथाजीन ऑप्शन में था. Promethazine is one of the highly sedative antihistaminic drug. They also do not have any enzyme inhibiting property. So promethazine के साथ भी नहीं होगा. promethazine भी ऑप्शन में था. Still the answer will be estemizole. ऑप्शन थोड़े ऊपर नीचे हो सकते हैं, आप समझ सकते हैं. आज आपका जो स्टेटस है, अभी मेंटल स्टेटस है, इट इज मच बेटर आई बिलीव कंपेयर टू व्हाट यू हैड यस्टरडे. तो ये अगेन रात में बच्चों से डिस्कशन किया गया है. इवन ऑप्शन में अगर प्रोमेथाजीन था, सेट्रिजिन नहीं था, लोराट्रिन नहीं था, अगर एस्टेमिजोल था, तो दैट विल बी द करेक्ट आंसर. Which of the following agent is used to prevent alcohol withdrawal seizure? So again, this is also PYQ topic. पहले एग्जाम में क्या पूछा था कि which is the most effective drug, है ना, वर्निक्स-कोर्साकॉफ, जो कोर्साकॉफ साइकोसिस वाला जो था. ठीक है. So इसमें पूछा which of the following is to prevent alcohol withdrawal, है ना, अल्कोहल विड्रॉल मीडिएटेड सीजर को प्रिवेंट करने के लिए, तो वी आर गोइंग टू यूटिलाइज बेंजोडायजेपिन. रिमेंबर वी आर नॉट गोइंग टू यूटिलाइज फोमेपिजोल. फोमेपिजोल इज कंसिडर्ड एज अ एंटीडोट फॉर, it is an antidote for methanol poisoning या ethylene glycol, right? methanol or ethylene glycol. ठीक है. Disulfiram again is one of the aldehyde dehydrogenase inhibitor. They are mainly utilized as an aversion therapy, which will be the next potential MCQ for all of you guys. Which of the following will be utilized for the aversion therapy? ठीक है. Naltrexone again is an opioid receptor antagonist, and they will not be preventing the alcohol mediated seizure. Which of the following is incorrect regarding cyclesonide? Watch out the respiratory topic that we have discussed. Cyclesonide is one of the soft steroid. It's one of the soft steroids. They are having poor GI absorption. Poor GI absorption. Now look at this. Oral candidiasis is common because they are having poor absorption. Remember, poor absorption. Oral GI is common with its use. Incorrect पूछ रहा है ना? तो you have to choose because they are soft steroid. Oral candidiasis is not common. Oral candidiasis is less common. They are having equal efficacy, and remember, it is a prodrug activated by esterase. It has fewer side effect other than inhalational corticosteroid. Yes, so soft steroid or oral candidiasis will be the lesser side effect. A patient on MAO inhibitor was started on sertraline. What is sertraline? Remember, chef drug, citalopram, fluoxetine, fluoxamine, है ना? So this is one of the SSRIs, selective serotonin reuptake inhibitor. So this patient developed symptoms like headache, diarrhea, and agitation. So headache, diarrhea, and agitation, SSRI, MAO inhibitor itself is having increased risk of serotonin syndrome. और आपने पहले ही पेशेंट को MAO inhibitor दे रहे थे, बाद में SSRI यूज किया, या अगर हिस्ट्री अदरवाइज था, अब पेशेंट वाज ऑन SSRI वाज स्टार्टेड ऑन MAO inhibitor, अगर हिस्ट्री वैसे भी था, so they are going to have increase in the risk of serotonin syndrome. And serotonin syndrome के लिए we are going to utilize anti-serotonergic drug cyproheptadine. Cyproheptadine is having anti-serotonergic property. They are also having antihistaminic property. Antihistaminic with anti-serotonergic property. ठीक है. All right. So I think this question is also sorted for all of you guys. Now, next one that we are going to discuss is about which of the following is reason to add atropine. Which of the following is reason to add the atropine with diphenoxylate? What is diphenoxylate? Is an opioid. And in our opioid chapter, again, we used to discuss this one, that with diphenoxylate, we need to add atropine. Why atropine? Because atropine is one of the anticholinergic drug. So with the atropine, remember, with the atropine, if you are going to add, if atropine added, remember, the dose required for opioid, like your diphenoxylate, the dose required for opioid will be lesser. The dose required for diphenoxylate will be lesser. So they are not going to they are not going to antagonize the action, or they are not going to enhance the antidiarrheal effect to prevent the abuse. Yes, so they will have prevention of abuse potential of the opioid. Opioid के abuse potential को ये कम करेंगे. Opioid के abuse potential को कम करेंगे. TCA plus SSRI. चलिए, अगर TCA plus SSRI है, तो isn't that TCA is also having reuptake property, SSRI is also having reuptake property. History MAO inhibitor का हो, TCA का हो, या TCA plus SSRI का हो, again this is going to be a serotonin syndrome case, and the drug of choice cyproheptadine is a serotonin syndrome का drug of choice. This question I think also is sorted, opioid plus atropine. Next question is about a 25-year-old patient with history of unprotected sexual intercourse, and this is something that has already been asked in 2021-2022 NEET PG. आप 2021-2022 का NEET PG देखिएगा, उसमें डायरेक्टली इमेज दिखा के they have given this one, the intracellular gram-negative diplococci. They are actually talking about gonorrheal infection, purulent discharge, history of unprotected sexual intercourse, purulent discharge, burning micturition. So everything is talking about Neisseria gonorrhea, and the drug of choice for that case scenario, we are going to utilize either ceftriaxone. If it is not there, then we can even proceed with the cefixime. Since there is no drug allergy, we can utilize beta-lactam, third generation cephalosporin like cefixime. A patient with the symptom of tachycardia, tachypnea, hypertension, hypocalcemia after consuming an unknown substance. Now इसके दो वेरिएंट हैं. कुछ बच्चे बोल रहे थे कि सर उसमें दतूरा था. Now दतूरा was in the first मॉर्निंग वाला सेशन में, लेकिन अगर ये क्वेश्चन ऐसे ही आया था जैसे कि यहाँ पे लिखा हुआ है, टैकीकार्डिया, टैक्कीपनिया, हाइपरटेंशन, हाइपोकैल्सीमिया, बिकॉज कैल्शियम चिलेटिंग प्रॉपर्टी अगर किसी का है वो हाइपोकैल्सीमिया कॉज कर सकता है. अमॉन्ग द गिवन चॉइसेस, रिमेंबर, डिजॉक्सिन विल नॉट बी हैविंग कैल्शियम चिलेटिंग प्रॉपर्टी, neither methanol or iron. So the drug that is after ruling out, we can go ahead with the ethylene glycol. Ethylene glycol is something that can actually be associated with this clinical scenario that we have. अगर दतूरा नहीं था तो इसको यहीं पे कट कर देते हैं. तो दतूरा वाला मॉर्निंग सेशन में था most likely. Next is going to be, when administering magnesium sulfate for eclampsia, which of the following would you not monitor? Which of the following will not be monitored? Urine output will be monitored. Deep tendon reflexes, very important to monitor. Serum magnesium level also you have to keep an eye. Blood pressure, there is no point of measuring the blood pressure in this patient with the MgSO4. नहीं सर, सेकेंड में मेंशन था कि हिस्ट्री गिवन बाय देम, यूज ऑफ सम सब्सटेंस अब्यूज, नॉट सब्सटेंस डज नॉट मीन. ऑगमेंटिंग द एक्शन, नॉट एंटागनाइज. एक मिनट, कौन से कह रहे हैं? ओके, टू ऑगमेंट द एनाल्जेसिक इफेक्ट. तो ऑगमेंट के लिए भी नहीं होता है. अगर ये मान लीजिए ऑगमेंट है, इफ इट इज गोइंग टू बी ऑगमेंट द एक्शन, रिमेंबर है ना डॉक्टर दीपांजन दास, अगर वो ऑगमेंट भी था तो ऑगमेंट विल नॉट बी, इट्स नॉट गोइंग टू ऑगमेंट, इट्स मेनली एन एंटीकोलिनर्जिक. सो एंटीकोलिनर्जिक ड्रग विल आल्सो हैव एंटी सिक्रेटरी प्रॉपर्टी. तो ओवरऑल डोज रिक्वायर्ड फॉर द ओपियोइड विल बी लेसर. तो इसलिए अब्यूज पोटेंशियल को प्रिवेंट करने के लिए मेनली हम उसको ऐड करते हैं. इन विच ऑफ द फॉलोइंग क्लिनिकल ट्रायल डोजिंग इज प्राइमरली डिटरमाइंड. डोजिंग आप पहले हमेशा हेल्दी ह्यूमन वॉलंटियर को देते हो, वहीं पे डोजिंग डिसाइड होता है. कहाँ तक आप बेसिकली सेफ्टी डोजिंग कहाँ तक आप दे सकते हैं, वहीं पे डोजिंग डिसाइड होता है. सो दैट इज गोइंग टू बी योर फेज नंबर 1. बिकॉज फेज 2 तो थेराप्यूटिक एक्सप्लोरेटरी ट्रायल है, यहाँ पे डोजिंग डिसाइड नहीं करते हैं. एफिकेसी के बारे में बात करते हैं, थेराप्यूटिक एक्सप्लोरेटरी ट्रायल बोलते हैं. And this is phase 3 is a replica of phase 2 with more number of patients. So this is known as your therapeutic confirmatory trial. Therapeutic confirmatory trial. And phase 4 is the post-marketing surveillance, right? SNRI given in ADHD. Now ये question कल evening में I think some student have given me, तो I have discussed in session 1 as well. अभी session 1 में था, session 2 में था. अगर session 2 में था तो कल भी मैंने इसके बारे में बात किया था कि SNRI, सेरोटोनिन नॉरएड्रेनालिन रीअपटेक इनहिबिटर, दैट कैन बी एक्चुअली यूटिलाइज्ड फॉर ADHD, अटेंशन डेफिसिट हाइपर एक्टिविटी डिसऑर्डर. मोडाफिनिन, सी ADHD का नाम सुनते ही ज़्यादातर बच्चे मिथाइलफेनिडेट पे चले गए. मिथाइलफेनिडेट अनडाउटेडली कैन बी यूज्ड इन ADHD, बट इज इट SNRI, सेरोटोनिन नॉरएड्रेनालिन रीअपटेक इनहिबिटिंग प्रॉपर्टी, या अगर आपके नाम में मान लीजिए नॉरएड्रेनालिन रीअपटेक इनहिबिटर था, ठीक है, SNRI था, ADHD. तो among the given choices we are going to proceed mainly with the atomoxetine. We are going to proceed usually with the atomoxetine. ठीक है, atomoxetine is having noradrenaline reuptake inhibiting property. ठीक है, तो अगर ये तो हो सकता है ये मॉर्निंग सेशन में, बिकॉज येस्टरडे इन इवनिंग ऑल्सो आई डिस्कस, तो वहाँ पे भी बच्चे ने बोला कि सर ये हमारे क्लास में नहीं आया था. तो अगेन या तो मॉर्निंग में था या इवनिंग में था. वी गॉट दिस क्वेश्चन फ्रॉम द स्टूडेंट इटसेल्फ. ठीक है, so this was a question. Let me quickly go through this one. What are the questions that we are having? SNRI used in ADHD. I am telling you atomoxetine. Undoubtedly, methylphenidate is the drug of choice, but question is asking SNRI that can be utilized. ठीक है, dosing is primarily determined in phase 1 clinical trial. We are not going to monitor blood pressure in monitoring of the MgSO4 dosing. Ethylene glycol can produce the shown side effect like hypocalcemia, tachypnea, hypertension. Cefixime for the Neisseria gonorrhea in the given case history. And along with the opioid, we are adding atropine to prevent the abuse potential of this opioid. Cyproheptadine is mainly the drug of choice for serotonin syndrome. This was one question. Oral candidiasis will be less common with Ciclesonide, which is a soft steroid. Lorazepam will be given to prevent the seizure due to alcohol withdrawal, and QT prolongation will be caused by enzyme inhibitor. Estemizole is an enzyme inhibitor. Niacin will be causing flushing, raised hepatic enzyme and hyperglycemia. Then tesamorelin, GHRH analog, that will be given for HIV mediated muscle mass loss. And clonidine will be causing your side effect that I told you, dryness of mouth, rebound hypertension. This we have already covered here. Volume of distribution will be mainly it will decide mainly your loading dose. And in a patient with angle-closure glaucoma, mannitol और pilocarpine. अगर mannitol plus carboxymethyl cellulose था तो उस condition को भी we will not be considering as an answer. Pilocarpine is M3 agonist that is going to cause the meiosis. So this was everything that we wanted to discuss in our this session. But rest assured, very soon we are going to have our detailed analysis with the full option once again once we get all the question, because I have got some other question as well, like there was a question of methotrexate, there was a other question as well that we got. So we will try to collect the remaining question that we have got from the student, complete the question, and we'll come back again with the detailed analysis. Thank you very much to all of you guys. Please enjoy the next series that is going to come in this recall series for all of you guys. Bye bye.